All right. Testing, testing, making sure my microphone works. Good.
I see the lines.
Okay, so we have 2 more minutes. So for the people who joined in a little early, we have 2 more minutes until 4 o'clock. So welcome. Thank you so much for coming in. I'm going to go a little closer just in case it's a little easier. So this is the Workday Resilience thing that I'm trying to do for the workforce. So it's really designed as an accessory workout, and I'll go a little bit more into it. But so for future references, we're going to try and do everything without any equipment, but for just for today. But in the future, I might have us get a little bit of a band. So it could be any type of resistance. You want something light, something a little heavy, but not too heavy, because we're trying to build some endurance with this. So, but yeah, if you have any questions, let me know after the fact. Let's see, we got 1 more minute. So my helper back there, we're going to get, or 3 more minutes. Okay. So yes, this is really my passion, to help out people in the workforce. When I was a PT in the corporate scene, no one really helped me out. So I asked my bosses, hey, can we spend some time helping each other out? And they sort of laughed at me because it wasn't billable hours. Like, how can we make money off of it? And I'm thinking, well, I have a headache and stuff. It'd be nice to, work on each other, get to know your coworkers a little bit better, make them feel better, and help each other out. But so that's kind of my mission, is to really help the working professional feel heard, and hopefully teach you guys how to help yourselves out with any work-related pain. You don't have to deal with it, and it's not part of the work environment. We want to try and help you out with that. So let's see, we got 2 more minutes. 2 more minutes left. Okay. All right, so if you guys are still coming in, thank you so much. So I'm kind of just killing time until it's 4 o'clock. But if you don't want to hear this, we got 1 more minute. You can just fast forward it just 1 more minute, and then we'll get started. So welcome everybody coming in. My name is Henry. I'm a physical therapist in Tempe. So I'll kind of be going over this just really quickly once we get started, and then we'll get going with everything. It's going to be fast paced, so you only have 30 minutes to get going, and we're not going to be doing any squatting or anything like that. We're just going to do some good mobility stuff and get after it. We don't have time. You can do this at your desk, at your at home, at the gym, places like that. So I really want to make this convenient for you. All right. What do you think? Is it 4 o'clock? Time to start? Okay. All right. Well, it's 4 o'clock, time to get going. My name is Henry Saldana, owner of Saldana Physical Therapy, along with my wife, Lindsay. She's pelvic floor physical therapist. So I am here. Thank you so much for being here. It means the world to me, and I really want to help you guys out, the workforce. Dental professionals, corporate workers, people that work at desks, hairstylists, teachers, everybody, hygienists, all that. I don't want to forget anybody, but I want to help you all out in the workforce. You guys work so hard for us. Now I'm here to help work for you. And I want you to use me to the fullest of the ability. So this is my way of showing you a little bit of a piece of what I can do. So this is the Workday Resilience Initiative that I'm doing. So these are accessory workouts, and they're meant to really support your main workouts if you do have a good program going, and as well as your workday duties. So it's not replacing any strength training or compound lifts, but just to really add to it and make you a little bit more comfortable with your everyday work stuff. So what I'm trying to help out with is people who do repetitive motions, the dental professionals, the surgeons that have to bend over like this all day. Ergonomics will only take you so far, but we need to build resiliency in those tissues, and I want to help you out with that. So also the people who work at desks, whether they're going like this sitting all day, I want to teach you some things to really help out with any type of pains that you have. So what do I really help out with? This is helping out with headaches, neck pain, shoulder aches, numbness and tingling down the arms, back, just a little bit of everything. But just remember, this is not a substitution for a physical therapy evaluation. I've worked with a lot of patients, and these are some of the common things that I've seen. And I want to give you just a little taste of a little what I want to try and help you out with. So this is a good entry point for you, low barrier, 30 minutes. It doesn't take a long time. And you can do these exercises every day. And I'll kind of go through it as well. So let's get down to it. So the first thing that I want to start off with is, let's start off with some arm circles. So we're just going to do a very quick, easy warm-up while I kind of introduce things, and then we'll go from there. Everything is modifiable. Go ahead and do this with me, and we'll try and stay on track with the time frame and everything. So everything's modifiable, adjustable. Let's switch it. So the goal is to leave feeling better, not wrecked, like you're doing heavy, heavy squats. So if you feel like you're going to feel this tomorrow, ease up on whether it's the quickness of it, the range of motion, or the repetitions or time of it. So bear with me. We're going to feel what your baseline is. So I want you to take an assessment right now. How do you feel? How did you feel going into this? And then afterwards, I want to see how you feel. Your body might feel tired. You might feel better. You might feel no change. But I also want to see what the total compilation of all this consistently does for you. So the next one will be wrist stretches. So we'll kind of go back and forth like this. And we'll just work on one arm at a time for about 30 seconds. So I'm just going to layer in some education for us. And hopefully it'll resonate with you, and hopefully you'll like it and continue it. So this one is for those people who are stuck, either at the keyboard, holding instruments, everything gets tight, everything doesn't get as much movement as we would like it to be. So this is something to help force you, let's do the other side now, to make sure we pay attention to all that. So this may seem easy. Yeah, this is dumb. Like, of course I can do this. Yeah, but do you do it consistently? Do you do it enough to make a change? So that's what I'm going for, is trying to do these enough, call attention to it, and kind of figure out, what does your body need? And then you guys can tell me exactly, okay, I like this, I don't like that, let's modify it a little bit. Okay, so the next one is arms extended. So we're going to twist our body with this, twist with an extension. So you can just stand in place. Hopefully you don't hit anybody else around you. I have a little 10 by 10 area that I'm working in to try and simulate that environment. So this one is really working on a lot. You'll notice that these are more thorough exercises. We don't have time to do 3 hours of physical therapy or exercises a day. So I'm going to break these down for you very quickly and then show you why they're good. So this is not only twisting your spine, but it's also opening up the chest and getting a really good nerve stretch in the arms. So that's what we're going for. Nice and slow and controlled. Try not to ram it in there. You might feel your back crack, but I want you to be smooth and intentional with this. And don't go as far if you feel pain. I want you to really, really go kind of easy for today, and then see how you feel tomorrow. Okay, whew. So now we're done with the warm-up. So my list is right underneath the camera, so please excuse me. We're going to see if we can unload the back a little bit and work on those hamstrings. This is something that we all need, especially if you sit all day. So we're going to put your forearms on your thighs right here, and then think of this as a reverse squat. So we're not squatting down. We're keeping your eyes level and straightening the knees. Now, some people with very tight hamstrings, they won't be able to straighten out the knees. That's okay. This is a sciatic nerve stretch as well as a hamstring stretch. So if you're stretching nerves, we don't want to make them hurt, because they might go tingle. They might go a little bit numb for a few minutes or a few hours. That's okay, but that lets us know, okay, where do you need your body, and where do you need to start with with your body, and we need to listen. So with these, I'll have us do about a set of 20. So take a break if you need. If you have to start off at about 10 or 12, that's okay. Your baseline is your baseline, and it's different than someone else and someone else. So let's go for one more set of the hamstring pumps. I'll say these names frequently for you. So when we do sit all day and we don't get enough movement, we're grinding away at work, we have projects, we have complex procedures, this is going to really help us pay attention to those neglected muscles. When we sit, those hamstrings kind of go on slack, and then they tighten up over time if we don't continuously stretch them. So go nice and smooth. I don't want you to go too fast, and I don't want you to go too slow, but just right in the middle. All right. Ooh, shake it out, son. That one is good. So if you do feel a little bit of buzzing or tingling in the legs, that lets us know we need to work on those sciatic nerves and the hamstrings. Okay, the next one. So if you do have an extra, a jacket or a shirt or something, I'm not going to ask you to do something I'm not willing to do. So we're going to see if we can kneel. We can bend over a little bit, and then after that, we'll kneel to the ground, but just for a little bit of cushion for the knees. The first one we're going to do is bent over. So we're going to really try and stretch our neck. So what I'm going to have us do, bear with me, it's a lot of moving parts. We're going to do a chin tuck. So we bring our chin directly in, and don't do it so hard that you can't breathe a tuck. Just do it slightly a little bit, so you might feel a little bit of a stretch. And all we're going to be doing is rotating our head while holding that stretch. This is the basic beginner approach. We're going to try about each left and right is 1, left and right is 2. We're going to try about anywhere from 5 to 15 of those. But stick with me on this one. For the more intermediate, we're going to put your hands up like this, freeze, arms up like this, and then we're going to bend over. So keep that chest out. We're looking straight ahead, not forward, but straight down. And then we're going to do that chin tuck with neck rotation. Keep those arms up. Left, right, left, right. This will help even out some of those imbalances, not only in our neck, but also work on those shoulder blade stabilizers. Just 2 more. Whew, those burn. Let me know in the chat, or if you want to communicate with me, let me know where you feel that the most. So this is working on the neck. We need those neck muscles to stay strong. Once they get weak, we start to look like this. And we don't want to work like this. We don't want to work like that. We want a nice, upright, strong posture that you can hold. Let's do the second set for that one. So freeze, bend over, chin tuck, and then rotation. There's 1, 2, 3. Nice and smooth as well. Don't try and go too fast, and don't go too hard with these, because I've had patients that say even just doing a little bit made their neck a little sore the next day. And also go ahead and keep going for a few more sets. Don't mind if you hear snap, crackles, or pops. That's just our body moving it, lubricating things. There's some gases that are released. We're not trying to crank it really hard. Your muscles are doing the work for you. So just take it a little easier on the range of motion. See how you feel. And then if it's tight, you can always push it once you know that it's not going to make you super sore. So now the next one, now we're going to move the arms a little bit. Same position, chin tuck, but we're not going to move the neck. We bend forward, chin tuck in. We're going to make the letters I, Y, T, and then W. And then that's 1 round. We're going to try 5 rounds of those. So you can try it either standing up, that's the beginner approach, Y, T, and then W, trying to keep that chest out and the shoulder blades back as you move. Now the intermediate, let's see if we can get you bent over again. So bent over, we're stretching those hamstrings, chin tuck, I, Y, T, W. So now we're getting after all those tiny little muscles in all the different angles that we move our arms throughout the day, or the lack thereof of not moving the arms. And if you don't use it, you lose it. T, W. Who's feeling this in their hamstrings? Keep going. Chin tuck in, hold that chin tuck. Don't let it bend backwards. W. And then one more. I, Y, T, W. Whew. Quick break to shake it out, son. You feeling that yet? I'm feeling it not only in the back, the hamstrings, and the neck. So this means that I need to do it as well. And guess what? I'm not using heavy weight. All right, let's go for our second set. Follow me with this one. And then if you're only doing the standing one, that's okay. That's your baseline. I'm going to do the bent over one so you can see me. Chin tuck in. I, Y, T, W. And if you're wondering if it matters, the thumb up really helps get those rotator cuff muscles that want to shut off or get tired quick. It gets them going. So we want to train them to have endurance. For our skilled procedures, if you're a dental professional, oral surgeon, or if you just have to type, drive, do hair as a barber or a salon artist, and then have that endurance to be able to hold it. So last one, I, Y, T, W. It's a little late, but don't feel like you have to hyperextend it. Just go until it's straight. You don't have to force it. Whew. Wiggle your body out a little, get some of that fatigue out. So now we're going to see if we can bend down to the floor. So this is a hard ground. I'm going to get my knee on here, but if you have a cushion or for next time, we might do some stuff on the ground as well. So get yourself a yoga mat or a nice little pillow. So this one, we're going to do a, I'm going to see if I can stretch those tight muscles right here. I don't know if you felt that before, but not only that, we're going to work on the spine a little bit, the low back, as well as the nerves that go down the arm. So bear with me on this one. What we're going to do is try and tilt that pelvis, and that's to help stretch it out. So we tilt while we're in the kneeling position. If you can't kneel, try it standing. We tilt it backwards. The bowl is turning backwards. So bear with me. I'm going to show the kneeling first. One foot is down. We tilt the pelvis back. With the side that's down, we're going to raise that arm up. We're going to do an OK sign. This is going to get a specific nerve that likes to go numb on you. And then we're going to side bend. There's one, two. Follow me with this one. If you're standing, you can even do something like this. If you can't get down on the ground, that's okay. It's very hard down there. So try it like that. OK sign. And if you want to make it a little bit harder of a stretch, you can hold that pelvic tilt, go forward until you feel it. And then we can bring that arm down. Otherwise, I'm okay just tilting it sideways. All right, let's switch sides. And now come this way, tilt that pelvis. Okay, we're having a good time. And then we're gonna tilt to the side. Try not to let your back bend. We're tilting it to keep it straight. This is working on a lot of different things. So see clarification. If you're like, am I doing this right? Figure out how to send me a video. Connect with me on Instagram. Send me a video on Facebook Messenger. I'm on both of those. Whew. You feeling this yet? You might be getting a little bit of a glow on your forehead. All right, take a little bit of a breather. This was stretching some good stuff. Same thing, since we are stretching the nerves, if you feel little tingles, that's okay. Just back off a little bit. Do a little bit less range of motion or less repetitions. All right, let's come back here. Pelvic tilt, okay. And then side bend. And if you're really good, kind of like, I don't know if you did this when you were a kid, we used to go like this and then make the fake little mask like that. We're trying to do that as well to a certain degree. Just don't poke your eye out while you try it. Whew. I'm feeling this already. No weights. Okay. Let's do the other side. Okay side, pelvic tilt in. 1, 2, 3. This is a lot, so just concentrate on one at a time. If it's a little bit too many movements for you, I understand. It took me a long time to figure out how to do this, yet alone walk and chew gum while I'm doing this video. All right, good job with that one. Okay, so that was kneeling on the ground. We got some good low back, some good nerves, more different nerves in the arm. So now we're going to try another one on our hands and knees. If you can't get on your hands and knees, that's okay. Use a wall, use your desk or table, something that won't fall on you. So I'll show you real quick. What we're going to be doing is something called a bird dog. We're going to alternate arm and leg. So if we're bending over and touching the wall, we're doing something like this. And you can alternate it and extend the opposite arm, opposite leg. If you're doing it on the ground, which is a little harder, we can extend opposite arm, opposite leg. Make sure and keep that chin tuck in there. Each arm and each leg is 1, 1, 2, 2, and see if you can get a little bit of a tilt in there while you do that. Keep that spine really straight without holding your breath. This may take a lot of practice to get, and you might have done it before. I say give it some more consistency. If you need an upgrade, you can always tie a little loop around one of these bands and put it on your hand and on your foot, and then you can pull them opposite like that. Okay, take a little bit of a break. How are you guys feeling so far? I might get myself a little bit of a drink. Okay, let's get back into it. So if you're standing against a desk or a chair or a wall, that's okay. I'll show some more on the ground and we'll get to it. Chin tuck in, belly button muscle in, opposite arm, opposite leg. And I'll go to the side so you can see me a little bit better. And I'm doing about 5 to 10 of these. Each arm, each leg is 4, 4, 5, 5. If you could do more, I suggest doing a little bit more. We want endurance in these muscles as well as strength. We're learning more endurance and control of everything that we're doing here. Whew. All right, take a few deep breaths in through the nose, out the mouth. You might even get a little cardio with this. Okay, the next one is we're going to be doing some, you know what? If you don't mind getting on the ground, this is one strictly for the ground. Get yourself a yoga mat, or I'm on the ground too. Why don't you join me if you have the space? So we're going to come down right here. We're going to keep that chin tucked in because I don't want my head on the floor. We're going to see if we can lift up either alternating arms or all 4 of them at the same time, arms and legs. So come up and then back down. Come up and back down. Try not to hold your breath. If this is too aggravating for the belly or it's just too hard to do, try either one limb or only 2 limbs at the same time. This is alternating 2 limbs. But if that's a little bit too much, just worry about doing 1 at a time. Bear with me on this one. Just 2 more. I'll do this one and then this one. Okay, take a break. Whew. How did that feel? Is your muscles feeling like they're keeping up with you? Do they feel like they're not used to doing that? I want you to analyze how you feel while you're doing these, because that can help us either maintain the same workout till you get stronger or modify them, make them easier or harder to help benefit you at your work duties and of course your hobbies as well. All right, let's do another set. Let's try 10 total of these. Here we go. I'll be doing all 4. 1, 2, 3, 4. For the alternating people, you can alternate. And for the singles, just a few more reps. 2, 1, done. Okay. Whew. Very nice. If that's a little bit too much, don't feel like you have to do that one, or maybe try it later on when you have something more comfortable to do it on, a yoga mat or something on the ground for you. The next one is, I'll show you how to do it 2 different ways, but this is another one on the ground that gives you a huge amount of value. So what we'll do here is we'll go back on your tummy. We're going to have our thumb facing up on one side, and on the opposite leg over here, we're going to kick that leg up towards the sky. So we're using our gluteal muscles, and then we're going to tip over to the side. I'll try not to kick over my drink. Up, back down. Then let's switch to the other side. Thumb up about 45 degrees. Kick that leg up, use that bottom muscle, and then come over. And then we're just switching back and forth. Keep that chin tucked in. I'm not going to the ground because I don't want to hit my cup and spill my drink. This one's a little tough, so keep on going. Let's try about 6 more. For the people who can't get on the ground, we're going to put that thumb up right here, and we're going to turn our leg out to the side and then back forward. So it's like we're taking a step back and then coming back to straight. And if you want a little extra, you can bring your arm out too with that leg. Okay, take a break. We can alternate sides on those if you're standing as well. I'll show you the opposite side. But here we go, getting some blood flowing. So I'll start with the standing, but everyone, let's do this again. And here's my opposite side. I come up, thumb up. We're stretching that pec muscle. Take a step back, and then back forward. 2, 3, 4, and then on the ground, feel free. Don't go as fast as I did standing. That's okay. We're taking about 30 to 45 seconds on each one. This is really good for the spine, and only go as far as you're comfortable with. Just 2 more. If you feel your back kind of cramping up a little bit, just don't go as far. That's okay. It's just in a little bit of shock, like, what are you doing to me? All right, take a break. So we have 5 minutes left, guys. Thank you so much for bearing with me. We have 1 more left. This one's it's a little bit of a shocker, but we'll go 1 step at a time. This one, we're really going to get our spine to bend and get some of those muscles to release back here and also stretch out those nerves. I want you to imagine all the segments of your spine, they're going to be bending forward 1 at a time, starting at your neck. So this one, starting at your head, bend our neck, the top of the shoulders, the middle back, the low back, go as far as you're comfortable. We're going to see if we can walk out with your arms like this, and then we're going to stick our bottom into the sky and kind of try and alternate bringing our heels back. I call these little pumps. And then walk our arms back up, and then we're going to straighten our spine starting from the ground up. So if you're nervous about doing this, start slow and don't go as far. Only go as far as you're comfortable going. We'll do a few more of these. Keep going. Bottom up towards the sky. Pump those ankles. Come back up. Starting from the low back, straighten out your spine. Squeeze the shoulders back and your toes. Let's do 2 more. Bottom up towards the sky. Pump those ankles so we're straightening out those knees. Feel it in the back of the legs, the calves, and maybe even the bottom muscle. And we're working the arms too. Come back up, slowly straighten the back. Last one, here we go. Bottom up towards the sky, pump those ankles. We're almost there, guys. Thanks so much for bearing with me. Next week, we might have a different focus. This was a general style workout mobility to really get those accessory muscles back on track. Whew. So if you really like that, tell your friends, tell your coworkers, tell your HR or your boss, anybody that I might be able to reach out to help. So this is exactly what I'm here for, to really help make a difference in the corporate world. So just remember, everything is modifiable. I can try and tailor things, and then we always have to start somewhere and build it up. So here's your start. Congratulations for taking a step forward. If this is easy, there's ways to make it harder. And if this is really hard, don't worry, we can progress some of these things to meet you at your level. So if you're really liking what you're seeing and you want a little bit more of an individual approach, let me know. We can schedule a discovery call to see if working one-on-one would be more appropriate for you. I also have a 12-week program for the desk workers, for the dental professionals, salon, hairstylists, all of that. So if that interests you, there's different levels of care with that. This is just scratching the surface, but it's trying to show you and get my name out there of how I want to help you and being able to do the things that I want to do. So, and get you back to where you want to get back to, being at work with less pain, enjoying your time outside of work, at the gym, doing your hobbies with your family, all of that stuff. So please reach out and message me if you have any questions at all. And if you like these, we'll hopefully see you next week. And if you can't make it live, remember, we do replays. Just let me know, or if I don't see you on the roster, I'll send you a replay link that's going to be on my Saldana Physical Therapy YouTube page. Thank you so much again. I'll stay on camera for a little bit longer just in case if anyone has any questions, but otherwise, that's a wrap. Have a great day. Oh, question, yes. Okay, so if you have nerve pain, so it just depends. Do you have your nerve pain just when you're working, after doing certain things, or was it when you were doing some of these exercises? So what I said before was muscles, we can stretch, that's fine, as hard as you want. Nerves, we want to be very careful with. When you do nerve stretches like what we did, go until you feel a stretch with no pain. And that's period. As these get more resilient and stretch more, you should have a little bit less pain as long as we're not overdoing it. Good question. And we can always go over more nerve stretches the next Friday if that's a big topic. Okay, so excuse me. So I know this is a 30-minute one, and the aim is to try and be as convenient as possible. I know you guys don't have a lot of time. If this is too long for you still, break it up. It all doesn't have to be done at the same time. And that's what I'm here to show you, all these nuggets, pro tips and everything. Here's another one to throw at you. You can do these in between clients or patients. If you're in a procedure and it's been over 60 to 90 minutes, they're not going to get mad at you for taking 5 seconds, standing up, doing a few stretches, and then getting back into it. Do those micro movements. Do 30 seconds at a time as you have time for it. And then also you could do them every 60 or 90 minutes if you're stuck at a desk all day, or a tough procedure, or a long appointment. Good, good. Any other questions?
Would it be better to do this at the gym?
Okay, so the question was, would it be better to do this at the gym? And I have to say, it's not better or worse. It all comes down to what is your comfort level. I want to make this as convenient as possible for you so you feel comfortable doing it any and everywhere that you want to do it. The fact of the matter is, if you don't consistently work on your body, then it won't get better. Doing this once a week will help, but it might not be enough to help your body recover and make a lasting change. So that's what my aim is, consistency. And that's okay. Yes?
You mentioned that they need like endurance, does that mean that we need to start doing like long running and cardio?
So the question is, you talked about endurance. Does that mean long distance running or cardio type of stuff? Good distinction, because there's cardiovascular endurance, being able to do something for a long period of time. What I'm talking about is muscular endurance, to be able to use our stabilizing muscles, shoulder blades, our core, our neck for prolonged periods of time. Now, once they start to get tired, I don't know if you've seen this, we start leaning on our ligaments, on our spine, on our shoulders, and then over time, this doesn't happen overnight, but that can cause dysfunction. And then after years, months, years, or even decades, that's when people come in. This is being proactive, so you don't have to see me in the future, so we can maintain your muscle endurance to hold your posture during all of that stuff. Yes, another question?
What if I can't hold that posture?
So the question was, what if I can't hold the posture? So this is exactly why we're doing this. We're building up the strength. So wherever you start, this is a no judgment zone. This is your baseline. We have to build it up from there so you can perform your work duties and or maintain your hobbies, be there for your friends and family, stuff like that. So if you do recognize, I want you to also notice, if you do this consistently and work on some of these posture muscles, notice if you're able to hold the posture longer. Use some of these techniques that I showed you, and then give yourself those wins so you could know, I'm putting in the work and now I'm seeing the benefits. Well, no wonder. You're putting in the work, you earned it. All right, any other questions? Okay, so reach out if you have any other questions, but don't want to say any now if this is a replay. I'm always here for you. I like to put those FAQs and all that in whether it's a newsletter or I could talk about it live next time. So once again, thank you so much. I feel honored you joining me. Have a wonderful rest of your day, and I'll see you next Friday.